Well, I hit my first risorius, guys, and of course I wanted to get on here and share my experience. If this has happened to you, it doesn't make you a bad injector. These are risks we take with neurotoxin injections, right? I've been injecting for years and this is my first one, and I want to share my experience and hopes to help another provider. So let's dive into what happened. You can clearly see my patient is struggling to bring out the left corner of her mouth. So that tells me that the left risorius was impacted. So let's break down the anatomy. So this patient presented to me for masseter tox injections. We have a long-standing history of injecting her masseters with much success. She gets this treatment for TMJ symptoms, clenching, grinding, migraines, and it really helps soften those symptoms for her. This presentation or this day was unlike any other. I injected about 20 units in her masseters. Now, what is the masseter muscle? The masseter muscle is a big, powerful muscle involved in clenching and chewing. It sits on the side of the face. It originates on the zygomatic arch and inserts into the lateral face of the mandibular ramus. So this muscle, its function is to help you with clenching and grinding and moving of that jawline, right? So we inject this muscle, we weaken it with neurotoxin. Typically 20 units per side is my starting dose. I typically do a 4-point injection technique, always respecting the possibility of impacting the risorius. Now, the risorius muscle is a thin muscle that lays over top the masseter. This is a thin muscle that connects all the way to the corner of our mouth, and it helps draw out the corners of our mouth laterally, so it helps us smile. So that's our risorius taking effect, right? It connects right here and pulls out the corners of the mouth. With this patient, what likely happened is when I injected her masseter muscle with neurotoxin, some of that spread and impacted the risorius. So now you could see that left-sided corner of her mouth cannot open up like the other side. So how can we avoid this in the future? The reality is that in my honest opinion, I always lean on the more cautious side. I sit low in that masseter muscle. That masseter muscle is a thick, juicy muscle. I typically sit on the inferior portion of that masseter muscle. I always inject with a retrograde technique. So I insert my needle all the way down to bone and then retrograde inject. My goal is to obviously soften the bulk of that masseter muscle. So I do try to find the meatiest part of that muscle to really soften it. But the goal is to sit more in that inferior part to avoid that risorius muscle. Unfortunately, it did impact her muscle. I will say this lasted her about 4 weeks, give or take, but a good amount of time. So that tells me that a good amount of units did bleed into that risorius. Unfortunately, the treatment options are very limited. You either impact the other risorius and have so that she doesn't have an asymmetrical smile, both corners of the mouth can't draw out, or you watch and wait. I'm a watch and wait conservative type of girl. I don't know how many units really bled into that risorius muscle, so I don't want to go and add concentrated, clear units into the risorius muscle on the other side and really knock out that muscle when the left-sided muscle can resolve quickly, and now we truly impacted the right risorius. So for me, I chose to watch and wait with this patient, but I think what's really important is that she was so graceful about it. She really handled it so well. She would send me videos of her updates and was really honestly really kind-hearted about it. I always tell patients injectors are more mortified than patients when a complication happens because it's our results, right? Our goal is to take care of our patients and give them beautiful results. So obviously when these things happen, we take it to heart and we feel so bad that this is happening to our patient, right? But what was really great is she understood the risks. When I injected her masseters, I go through all the risks, and these are the risks I talk to them about. Potentially hitting the risorius. I talk to them about potentially worsening the appearance of the jawline laxity. Because remember, if you weaken that hypertrophic or hypertrophied masseter over and over again with repeated masseter injections, what can end up happening is you atrophy that muscle down, right? Well, that thick muscle was originally creating tension on skin, basically pulling back skin because it was using up area of that jawline. Now you weaken it. Where is this skin going to go? You don't lose skin when you weaken the masseter. That skin is just going to fall slightly forward. So the risk is minimal when you're more youthful and not experiencing jowling. But any patient over the age of 40 that comes in to my office with TMJ symptoms, I am always talking to them about the potential risk of worsening their jowling. So that is always, always what I bring up. And then number three, I talk to them about paradoxical bulging. I do have another video about paradoxical bulging that did happen to my patient in the past. I'll pin that here. But paradoxical bulging is when one part of the masseter muscle wasn't impacted and it overcompensates. I always use the example of the masseter muscle has two bellies and it's like a beautiful relationship. When one is knocked out by neurotoxin and the other isn't, it's going to overcompensate and bulge. This fortunately, complication is an easy fix. You kind of just have to go in and re-inject and basically knock out both bellies so that one isn't overcompensating. How I avoid that is that retrograde injection. I go down to the bone. If your needle does not tap on the bone, then your needle isn't long enough. Go grab a longer needle and make sure it goes down to the bone, and then you retrograde inject your neurotoxin all the way up to make sure you hit both bellies of that masseter. That is crucial. Since I started using that retrograde technique, um, I have not experienced a paradoxical bulging. But paradoxical bulging doesn't necessarily mean technique was wrong. It could also mean that it wasn't enough units to thoroughly knock out the masseter. So don't put all the blame on you. It can happen. It's happened to me. But this was my first risorius impacted, and I just wanted to share that with you guys. So if you loved this video, comment below with any other topics you want me to talk about. I am a complete open book. I do not gatekeep. I'll share any of my complications and how I kind of navigated through them. But I hope you enjoyed it.